Hello everybody, it's Stormy here, and a lot of you wanted to know what I wanted to do about my botched facelift. I panicked a little bit before coming up with a decision, but then like the scars are so visible still, and it's just my face is just not lifted as I wanted it to be. And I panicked a little bit, as I was trying to say. Oh, thank you for telling me that I still look cute. Thank you. But we all know I don't. I've received so many comments about the way I look, and I have to agree it doesn't look good. I wanted something else for my face. I'm so grateful that you still love me regardless, but right now we're going to hop on a call with her and see how we can fix this face. Hi there. Hi. It's so nice to finally meet you. I've heard a great thing about you. I just wanted to know if it's okay for me to film. I am live streaming with my fans in this moment, and I wanted to know if it were okay to share this conversation with them. Your staff said it was okay, but I just wanted to double check and see, make sure there was no problem. Of course, it's always a pleasure to have your fans as viewers. Hello everyone out there. It looks like you've had a previous facelift and you would like to have the procedure revised, right? Yes, I don't like the result. I kind of like the idea behind it, but I think it looked kind of natural on me. I was thinking more of a fox lift, ponytail lift, fox eyes, all that, and it's just not it. I cannot see it. Sure, I understand. So we were talking about the facelift revision, and then here it says that you were open to try other different procedures. Is that correct? Yeah, I was thinking about getting a couple dermal fillers for the lips, get them a little more plumped, and maybe go for a breast augmentation, go a couple sizes up for a fuller result, if that makes sense. Okay, so we don't usually perform lip injection under anesthesia, but as we have a little bit of things to do all at once, we can definitely do that as you are on the table. We can definitely have a look at what better suits you and have different options as well, if that may be the case. Okay, sure, but like natural, right? Yes, of course. We want to just enhance your beauty and absolutely don't do anything that is over the place or exaggerate. Talking about the breast implants, have you already come up with a decision? Are we talking about saline or gel implants? Definitely gel. I don't like the risk of deflation with the saline, Sure, that's understandable. I tend to prefer allergan implants. I don't know if you've ever heard of them before. They are usually very appreciated by our patients, and the satisfaction ratio is very high, as well as the final result is always very pleasant, very natural, very full. Were you thinking of going up a couple sizes? Sure, just a little boost. I don't want it to be obvious that I get them done, if that makes sense. Of course. Do you have any other questions? No, that seems like we've got it covered. Just a natural boost for the lips and the breasts, and of course the fox eyes and ponytail lift is a little more specific, but still I don't want to look like an alien. I want it natural, you know, but still visible, like effective, like it's great done, right? I think we covered pretty much everything. We're on the same page. I'll have our scheduler get in touch with you for the operation, and we will do everything we discussed here, and then I'll see you 1 week later for the post-op check. It was a pleasure meeting you. Nice meeting you as well. Okay guys, so you've heard what we want to get done for the procedure, and I am so excited. I cannot wait to show you the final result. Are you nervous for your surgery today? When you will wake up, you will have the face and body of your dream. So just to quickly recap, we are going for the ponytail facelift, yes, lip and breath augmentation. Okay, we decided for a saline implant for your breasts, Juvederm on the lips, and a nice Ariana Grande Bella Hadid look for the face. Okay, now just allow me and my equipe to make everything work wonderfully. Okay, we are starting with a little bit of anesthesia right in your trip. You shouldn't feel any pinching, any pain, anything. Okay. And now if you can't count backwards from 10 to 0 for me, thank you. 9, 8, 7, and she's gone. Okay, let's just get the nip and tucking started. Starting with the ponytail facelift. Going for some very small incision right behind the hairline, so that there will be no visible scar. Okay, like so. Right behind the ears as well. And behind the jaw, so that it will not be visible. Okay. Good. Now I'm going to section the parts that I need to remove in order to lift the face. Chopping. Chop. Okay, let me just go here. Chop. I want the eyes to be more lifted. Okay. Okay, and now we pull. Oopsies. That was too much of a pull, I guess. Now I have to even that out on the other side. But it's good. She will love the final result regardless. Okay. It's pulling. Good. Okay. How are we looking? I guess it's pretty symmetrical now. So it's time for a couple stitches. Let me just stitch that out. Stitching here. To make extra sure that stitches don't go away. Alright. Okay, let's now clean up the wounds. How is she looking? Wow, I get supermodel vibes. She's gonna be so happy about the result. I think I want to go with the breast augmentation first, just because, you know, anesthesia might not last long enough and we want to be done with the boobies, so I'm just starting to do a little incision just here in this crease so that nobody will notice this color, and also here. Another that goes like this. Like so. How is it looking now? know you wanted something natural, solid implants, but look at you, you need more than that. So let me handle it so you're not going to be willing to undergo another surgery as soon as you're done with this, okay? I'm going to use two 800cc implants on you. You will love how that looks. I'm gonna place one below the muscle, just right here. Okay. And one above the muscle. Oh my gosh, you're gonna have the most beautiful chest in the world. So, just making it pass through this tiny little incision. There we go. Okay. Nice. And now we do the same thing on the other side. So insert the first one below the muscle. There it goes. The second implant above the muscle, just making it pass through this tiny little incision right here that will leave the smallest undetectable scar, and just placing the implant right here. There we go. Good. I wanna try to see if I can sort of inflate those for a more natural result. The one below the muzzle, like so. And the one above the muzzle. So, let me see. Okay, I think it's looking good. So I can proceed. One below the muscle and the other side. Good. That should be enough. And the one above the muscle. Good, but maybe not really symmetrical. We're looking now. Maybe another little bump here. And now here. Gosh, this is gonna be a pair of they are even. Just it feels pretty firm to the touch. Okay. I'm just gonna perform a little massage to to help the implants really get into their socket. And on this side as well. They look nice and squishy to me. Okay, so the breasts are looking really awesome. Let me just take a quick couple measurements here to see. Yeah. Yes. Yes. Cool, okay. Well, I think they are pretty proportioned. I mean, on the bigger side for sure, but who wouldn't want this result, especially with her job? I think this is gonna bring her so much more success, definitely. She will thank me. Okay, so now for the lips. So we said Juvederm. So Juvederm, here we go. I'm not really sure. I just doesn't do her any justice. I think she deserves more. Yeah, I think we can go with implants here as well, actually. She'll be so happy about it. Let me grab my little tool here. We're gonna go with a little incision. Just here. Kind of behind the lip, close to the teeth, if that makes sense. Same thing for the upper lip. Okay. There we go. Now I'm gonna go with the implant. This is a great, amazing substance because it's moldable and just follows the shape of the lip. So when she smiles, they expand. When she's serious, they contract. They bend and break into awful things. So gently shape it to a nice plump lip shape. Okay, good. Let me see. very voluminous and no need to touch up. She will love me. Let's just cleanse this one as well. Okay. Okay, nurses team, it's your time to finish and ultimate the stitching and sanitizing of the wounds. Wake up the patients and schedule an appointment so that we can do a checkup by next week, alright? Guys, time for the big reveal. These bandages are going to come off today. I'm ready. I'm so excited. Okay, so what do we? Oh my god, you guys, what the hell is this? What's wrong with my lips? Oh my gosh, my eyes. My breasts. Oh. I'm sure it has to be the swelling, right? Oh my god. I'm gonna call and ask for an explanation. Stay tuned. Hey, how are you feeling? Well, I guess I have some concerns. Let's start with the lips. Is it normal that they are this big, or is it just the swelling? The swell should be very minimal right now, and you should be pretty much healed. Would you mind putting your lips closer to the camera, please, so I can better see? Yeah, those look great. The implants seem to be in a great position, and the symmetry is good. I would call it a great result. Oh wait, what implants? Didn't we use Juvederm? Well, we did say that we wanted to go with Juvederm, but once I got you under, I realized that the volume just wasn't there, and I couldn't reach that fullness that I wanted to give you. So I chose some implants instead, so that your lips will look like this for the rest of your life. No need to touch up anything. It's just permanent, full, and healed. Well, that's great, I guess. And what about the lift? Is it meant to get less tight over time, or is it the final result? No, that's not really a problem with this kind of procedure. The ponytail facelift is meant to be very extreme, and you'll have these beautiful huge eyes for the rest of your life. Oh gosh. Okay, and what about this? We no longer do double implants anymore, but we actually went for 800cc below and above the muscle for you with these saline implants by Mentor to give you this full look. They look rock hard, they look tight, they look firm. We wanted to really give you the breast you wanted and you deserve. That's not what I wanted. I wanted a small change. No, please, I can't even fit anywhere. They're too huge. You don't think this is better? Look at your magnificent proportions. No way. They are not magnificent if I cannot fit through a door. I wanted a slight change, something natural. for sure not this. Do this look subtle or natural to you? No. Well, no, dear, but now that you have them, aren't you happy about them? No. No, I'm not. I need to go now. Bye. You guys are still watching. It will be fine. I'm sure I will be fine. We'll find a way to figure it out and everything will be okay, right? Yeah. Thank you for watching and always supporting. I gotta go now. Talk to you soon. Bye.